Does the president know about this self-promotion campaign that you're carrying out with official HS resources?
I didn't know about a number of those videos. We have
They've all come out like in the last 6 weeks, a couple of months.
I just happen to not see them. I have no idea if the president.
So you don't know how your own team is managing official U.S. Resources and promoting you in the process. So the president hasn't authorized you to use HHS resources for these vanity projects?
You know, I was asked the other day by one of the senators about the Kid Rock video, how much it cost the U.S. government, and I asked my team how much it cost, and they said zero.
Interesting. I mean, you were at Kid Rock's home. Did the president authorize you to use official HHS resources for these vanity projects? That's my question. Have you discussed them with the president? Did he authorize the use of them?
I've never discussed it with the president.
In 2025, the United States recorded more measles cases than at any point in 30 years. Robert F. Kennedy Jr. was the Secretary of Health and Human Services, the agency responsible for promoting vaccines and managing the nation's public health response. While that outbreak was ongoing, his agency's official government social media accounts were running a different campaign. Senator Maggie Hassan of New Hampshire came to this hearing with a list. Here is what she read into the record.
Thank you, Mr. Chair, and Senator Wyden for holding this hearing. Thank you, Secretary Kennedy, for being here this morning. Look, I have noticed that while HHS has done relatively little promotion of the life-saving measles vaccine that we were all just discussing, you have been doing a lot of your own self-promotion using official government channels and resources. HHS produced a video of you and Kid Rock exercising and drinking milk in a hot tub, I think at his pretend White House. Another official video features a dramatic sequence of you as a shirtless WWE fighter. You also posted a video on government accounts that depicts you as a video game hero. And you've even posted multiple photos of your younger self over time, your face, to say that you alone are the leader taking on big pharma in this administration. Does the president know about this self-promotion campaign that you're carrying out with official HS resources?
I didn't know about a number of those videos. We have
They've all come out like in the last 6 weeks, a couple of months.
I just happen to not see them. I have no idea if the president.
So you don't know how your own team is managing official U.S. resources and promoting you in the process. So the president hasn't authorized you to use HHS resources for these vanity projects?
You know, I was asked the other day by one of the senators about the Kid Rock video, how much it cost the U.S. government, and I asked my team how much it cost, and they said zero. Interesting. I mean, you were at Kid Rock's home. Did the president authorize you to use official HHS resources for these vanity projects? That's my question. Have you discussed them with the president? Did he authorize the use of them? I've never discussed it with the president.
All right. So as far as you know, he hasn't authorized it. Now, let me move on to a couple of other decisions that you've made. Did the president approve your decision to fire all 17 members of the CDC's vaccine committee in June of 2025?
You mean, did I talk to him directly? We talked to the White House DPC.
So, again, my question is about the decision process in this administration about firing 17 members of the CDC's vaccine committee that is established under law. Did the president approve that decision to fire the CDC's vaccine committee members in June of 2025?
Well, yes, he did.
Yes, he did. Okay, so now you also made changes to the vaccine committee charter just 2 weeks ago. It appears to get around the federal court decision that said you had improperly disbanded the vaccine committee. So did President Trump authorize you to do that?
DPC did, which is the Domestic Policy Council, which is in the White House.
So the Domestic Policy Council did, but have you discussed?
Thank you, Mr. Chairman. So after President Trump and the Republicans slashed health care for millions of families, the president pitched his TrumpRx website as the answer for Americans who are worried about healthcare costs. He claims that TrumpRx has reduced prices by as much as 600%, which I think means companies should be paying you to take their drugs. But let's do some real math here. Take one drug, Protonix, a 30-day supply of this heartburn medication, costs $200 on TrumpRx, but there is an identical generic version of this pill called pantoprazole. Secretary Kennedy, do you know how much it costs for a 30-day supply of that drug at Costco?
But I would say this, Senator.
Do you know what it costs?
President Trump has a different way of calculating. If there's two ways of calculating percentage. If you have a $600 drug and you reduce it to 10, that's a 600% reduction.
I understand that you know I only have 5 minutes. Do you know what the drug costs at Costco?
I do not.
The drug is $16 at Costco. TrumpRx charges $200 for Protonix, and Costco charges $16. Let's do another one. Pitocin is a treatment for heart arrhythmia. It costs $336 on TrumpRx, or you can get the generic at Cost Plus Drugs for $12. So you tell me, Mr. Secretary, are patients better off paying $336 on TrumpRx or $12 at Cost Plus Drugs?
You're comparing apples to oranges because you're comparing the brand drug to the generic drug.
Yeah, to the exact same drug.
Well, people should be buying the generic, and we will be directing them to generic.
To the exact same drug.
Yeah, we'll be directing them to the generic.
So tell me, Mr. Secretary, you think people ought to be paying $336 instead of $12?
Well, a lot of doctors prescribe the brand, so we're giving them 600% reductions on the brand. We will be directing them to the generic whenever it's available. You know,
so here's the thing. We know about brand names versus generic. It's a big pharma talking point in order to fool people into buying a more expensive drug. The generic is chemically the same. And here's the thing. If you're buying a drug on TrumpRx, there is a more than 1 in 4 chance that Trump's discount is actually a price hike. And for an anti-big pharma guy, you sure don't seem worried about steering patients to more expensive drugs that are going to pad big pharma's profits. But there's more in this deal. In exchange for these scam discounts, President Trump has exempted these drug companies from his 100% tariffs. So think about that. Big pharma makes billions of dollars in tariff relief by listing their drugs on TrumpRx, and then they don't even lower the costs on many of these drugs. That is a great deal for big pharma. So, Secretary Kennedy, here's my question. Did you sign off on these sweetheart deals for big pharma, or was this all President Trump's idea?
The tariff relief is only applicable if the company has agreed to produce the drug in America. They have 1 year to do so.
Well,
and then they don't get the tariff relief, and then it is going to bankrupt them.
So you're the one who negotiated these?
Did I negotiate the deal?
You negotiated these deals. Will you make those deals available to us so we can see them?
I didn't personally negotiate them.
All right. Did your team negotiate these deals?
Yes.
Will you make those deals available to us so we can see them? A little transparency?
We will make the I've already said this. I'm happy to make the deals available, except for proprietary information and trade secrets, which, when you pass the IRA...
I will hold you to that, Mr. Secretary, because if these deals with Big Pharma are so great for Americans, then we should be able to see what promises have been made.
You have the power to make this deal yourself. Why don't you do that? Why did you? We did this because you refused to do it.
I think what we've got is Trump University.
You have a lot more power to negotiate than we do.
Stakes.
We got the lowest prices in history.
By healthcare costs, and you and Donald Trump are actually making the problem worse. The American public deserves better.
Millions of people who are using TrumpRx disagree with you. I said the millions of people who are using TrumpRx
They got a
disagree
better
with you.
than 1 out of 4 chance of paying more at TrumpRx than they would if they went to Costco. That's not much of a deal for the American people.
Not on branded drugs.
Oh, so your answer is Americans should just not take prescription
We are
drugs? And
directing
that's the
people,
financial-
we will be directing people to the generics, the cheapest available. But a lot of doctors prescribe the brands, and we're giving them massive reductions in the brands.
So those mass discounts
Massive.
are that people can pay
600%.
600%. They can pay hundreds of dollars
Or more.
on TrumpRx, or they can get it for $12 at
This is
Costco.
the second instance of the secretary denying the public's right to know. That's all that the members on this committee have asked for.
All right, thank you, Senator Wyden, Senator Warren. At this point, to the rest of the members of the committee, we're going to take a 5 or 10-minute break, and then we will come back and resume the questioning. The committee will recess.
Kennedy told the committee he didn't know about the Kid Rock videos. He said he'd never discussed it with the president. He said his own official government accounts had been running a self-promotion campaign for 2 months, and he happened to not see any of it. He was also asked about TrumpRx, the program the president says offers the world's lowest prices on prescription drugs. Warren had the numbers: $200 on TrumpRx, $16 at Costco, the exact same drug. Kennedy said people should buy the generic. TrumpRx doesn't list the generic. He has cut 20,000 staff from HHS. He had not testified before Congress since September. This was his 6th hearing in 6 days. Subscribe and turn on notifications. The record, not just the press releases. I just happened to not see them. That was the answer.